the biggest difference that I've noticed for them are just rapid treatment, impactful results. I don't necessarily have to spend that much time with a client in order to have them feeling better, trusting me. They're walking out the door happy and excited for their next appointment. When you can deliver that kind of result, it just in minutes, seconds, it's really gratifying. My name is Lindsey. I'm a massage therapist, an esthetician, yoga practitioner, all of the things, but mostly a massage therapist. I'm a solo practitioner, Mandala Bodywork and Skin Therapeutics in Marion, Iowa, and Bettendorf, Iowa. I have 2 locations. Originally, I heard about Adhesion Release Methods through my own treatment. I actually see Dr. Cody and Thrive Care out in Iowa. I had experienced in about 2019-2020 sciatica, and very awful case where I was remodeling my space and started to notice I was really not feeling so great. I was going through multiple modalities, so I received massage just about weekly at that point. Started doing cryo, started doing laser, flotation therapy, generally so many different things, and it really wasn't touching the pain that I was feeling. I can't remember exactly who referred me, probably one of my clients who saw them for pain. As soon as I became a client there and was treated, it was night and day difference within the first couple of sessions. My first impression during the first accelerator is that I jumped in, maybe bit off a little more than I could chew. When I first started taking the online coursework, I was definitely sweating about it a little bit. My nerve skills are not as highly trained as those of chiropractors and naturopaths. As massage therapists, especially in the Midwest, our education is very limited. Coming back from the upper body really gave me a lot of confidence to introduce it more fully. And right now I'm looking at how do I get away from table massage. As a massage therapist, I spend upwards of 60 to 90 minutes with clients. And while, there are results there, it's just not quite the same. They're very different. I've only been doing test retest just right prior to ARM. And it was night and day difference when you have actual goals for clients. It's just the way that we focus on testing as an immediate feedback and just makes it a more informed treatment, right? Just being able to really hone in on what's really going on, or being able to distinguish whether or not we need to peel away the layers and something's unwinding, that's just been really invaluable, and it's definitely transformed my practice as far as the last few months have gone. All of Eastern Iowa and beyond, outside of that in the Midwest, there's very much a need for what we do, and I think the want to help people and help them in a more impactful way. I know so many people that do injections, surgery, things that aren't really all that necessary in the grand scheme of things. And while I can't say that as an informed surgeon, there are so many botched surgeries, and there are so many people that are still in such pain, and that is really difficult to see them come through my doors. And up until the last few years, I've really not had a great frame of mindset in order to help them out of that pain. Most massage is palliative at best, and I feel like there are really great practitioners out there performing sports and myofascial and things like that are making really big strides. And I think that is all very complementary, but not exactly the picture that people think of with massage therapy. It is still looked at as a luxurious thing, or just a relaxation thing. And I have definitely set myself apart in Eastern Iowa as a massage therapist that doesn't do that. So this is just me continuing my path on setting myself apart. My biggest hope, I think, for the training is to transform the way that my practice looks. And so far, I am getting a lot of technique, and a lot of areas where that's kind of surprised me in ways where I need to reconsider, I need to shift, I need to tweak the way that I'm doing things. And while these bigger goals are not off on the back burner, I feel like there's step 1, step 2, step 3, and it's a little bit more linear. So definitely have changed the way that I've been thinking since coming into it, as far as goals, and I think that there's just been a reshift of that. Dr. Chris is great. He's a really sweet guy, has a big heart. I think it's important when you do this kind of work as a massage therapist to lead with that. It's very important to address the clients that we are seeing day in and day out, to know that they're people, that they are experiencing pain, and we are helping address a massive problem, and that really just creates a bigger vibrational shift in frequency. If we can create more happy people in the world, or at least help them become a little more happy through pain relief and getting off of what many would call the medical merry-go-round of Western healthcare, I think that really kind of sets people up for, a lot of success. And he's really trying to help people get this technique and get it down and really understand it and spread the love that is ARM.
If you'd like to see more about how we fix chronic pain at Barefoot Rehab in New Jersey and with Adhesion Release Methods across the world, hit the like, hit the subscribe, and stay tuned for more videos that we will be releasing each week.